Are you confused about Medicare Part D prescription drug plans? Join the club. I am Kevin Knaus with InsureMeKevin.com, and I help people try and figure out what is the best Part D prescription drug plan for them when they reach Medicare age. And it's difficult, it's confusing. The insurance plan was written by the insurance companies, and Medicare has allowed the insurance companies to really play a shell game and change kind of some of the conditions and terms, and it just makes it really, really confusing. In California alone, there are 11 different what they call plan sponsors, that would be insurance companies, and they offer 32 different plans with such names as Basic, Choice, Classic, Enhanced, Plus. None of it means anything. Those are just all marketing terms to try and get you to focus on a plan without drilling down and looking at the actual costs for your particular drugs over the year. Now, Medicare does have a structure for the Part D drug plans. This basic structure shown here is plans can start with a deductible up to $445, and then you would go into the initial coverage phase. And that's the initial coverage phase is when you have set co-payments for drugs or coinsurance, like 25 or 33% of the drug. And then when all of those out-of-pocket costs, including your deductible, reach about $41.30, then you go into the coverage gap, which is just stupid on its face to begin with anyhow. And then you are paying 25% of the retail cost. I'm not really sure who determines that. The drug maker is supposed to discount the drug by 70%, and then the plan, your insurance plan that you're paying a monthly premium for, pays 5%. Oh, and remember that these Medicare Part D plans, they're subsidized by the federal government, by Medicare. So you would think they would try and make them a little bit easier to understand. Then when your costs plus the discount from the drug manufacturer and that little 5% from the insurance plan reaches $6,550, then you go into the catastrophic phase. That doesn't mean everything is covered. It just means the cost of the drugs drop way down to around 5%, or they have set copays if that's for like the generics and the brand name drugs. Okay, well that kind of sounds all right, except that that's not the way it really works in practice. So, of course, we have the structure of the Part D plans, but all of the drugs, those hundreds of drugs that each drug formulary has within each plan. Oh, and by the way, not all drugs are covered by all plans. One plan may include a drug and another plan may not. The drug plans must have, I believe it is, 2 drugs per therapeutic class if they're available, but there may be several, and your particular drug that you take that works best for you may not be included on one of the plans that you're looking at. So you really have to look at that carefully, because if it's not included, it's not on the formulary, you're paying the full cost. So they break these drugs up into these tiers. So Tier 1 is generic, that's usually the least expensive, then brand name and preferred, non-preferred, specialty drugs. There can be like 6 different tiers. And the plan sponsor assigns a drug to the tier, and of course the tier corresponds to a particular cost when you get into the initial coverage phase. So looking at a couple different plans, I went through the Medicare.gov finder to kind of illustrate how some of these drugs can move from different tiers from different plan sponsors. So on this one, and I can't pronounce some of these drug names, but we see that the Byetta is tier 4 with this one particular plan. The next plan, completely different company, has Byetta at 4, but then the glimepiride, which was tier 1 and the first one, is a tier 2, which means you'd be paying a little bit more for it under that plan. And then a third plan option has the Byetta dropping to tier 3 and the glimepiride back to tier 1. So they're all over the place is what I'm trying to illustrate here, that you cannot assume that a plan that you're looking at that has your drugs in tier 2 and 3 will be in the same drug tier with another plan, because that's how they manipulate this to extract the most money from the consumer and reduce their liability for paying for drugs. Here we have the overall plan structure for a couple different plans that I picked up. And you'll see plan 1 has a $445 deductible, but that only applies to tiers 3, 4, and 5. That's not too bad. You know, if you have just drugs in tier 1 and 2, you go straight into that co-payment situation. And you can see the preferred generics would be 0 under that particular scenario for plan 1. In tier 2 or 6, preferred brand are 40% for the non-preferred. Those are usually specialty drugs, injectables. And then tier 5, they have another one, and that's 25%. Plan 2, now there is no deductible in plan 2. You go straight into the copay in the coinsurance. But notice that the copays in the coinsurance are a little bit higher for plan 2. Then moving to plan 3, it does have a drug deductible, and then some of those copays drop down. So how do you even make sense of all of this? Because you have the structure here, but of course the drugs change between those different tiers. I mean, the whole thing is rigged against consumers in favor of the insurance companies to maximize their profits and minimize their liability. And it gets worse, because each of the Part D plans, many of them have a preferred pharmacy. So if you do not select the correct pharmacy when you're going through and looking for your drugs, you won't get an accurate estimate of the drug costs. Some plans may have CVS as the preferred pharmacy, and everyone else is out in network, which means you'll be paying more. Or there's Walgreens, and there's lots of drugs, pharmacies that you need to select when you're going through the Medicare.gov. So, and it may mean to get the best price, because see, that's where you have to kind of switch the pharmacies in the Medicare.gov program to see who has the best prices. It may be that you need to switch the pharmacy to reduce your overall out-of-pocket costs with some of these Part D plans, but that may not always be realistic. And if your pharmacist knows you and you like the pharmacy, you shouldn't have to change. It's just wrong that you just can't go to any pharmacy and get the same cost for the drugs as any other pharmacy. So kind of looking at some of these, I did kind of a Medicare.gov, which really is the best tool to use, the drug finder, because it will rank the Part D plans on a total cost, which includes the premium and the total cost of your drugs as you have entered them. So in this particular scenario, I chose CVS as the preferred pharmacy. You can see that plan A, that has the lowest monthly premium, actually had the lowest out-of-pocket cost for the consumer, $2,617. Now, it's the cost of the drugs plus the monthly premium. It does have a deductible of $285. And see, all three of those plans have a deductible, but they're not the same. So it's hard to, but of course that's one of the ways the drug plans kind of manipulate things. If there's no drug deductible, you're going to be paying higher copays. They're going to get you somehow. Now, I took this same scenario of drugs and I made Walgreens the preferred pharmacy, and the results were, pretty much similar. The lowest premium plan, Plan A, had the lowest out-of-pocket costs. However, with Walgreens, the drugs were, I believe it looks like $107 higher for the year than CVS. Not sure how that is all working out. So you kind of have to look at the different pharmacies, I guess is what I'm trying to say. It is just kind of a nightmare. If you're not taking any drugs, then you are enrolling in a Part D prescription drug plan in order to avoid the late enrollment penalty. And that's fine. You can just, look at the least expensive Part D plan and maybe that's going to work for you. But if you are on prescription medications, then you need to use the Medicare.gov drug plan finder tool to kind of sort through all of this. But you have to kind of work it and yet massage it and look at different scenarios. And it's complicated. It's just not easy. And it shouldn't be that way. But unfortunately, this is where we are left, because one of the things you also have to take into consideration is that some of the drugs that you take, that you have to enter into the Medicare.gov as taking them on a monthly basis, you may not be taking those every month. Some of those drugs you may only take every 3 months or on an as-needed basis, so that artificially inflates the price. So that's one other thing you need to keep in the back of your brain about how to compare all of these different plans. So if you're listening, Medicare, this needs to be a lot simpler for people, and you need to take the drug company and the insurance company influence out of it, because I am just convinced that most people are not maximizing their premium dollars because it is just too difficult to find the right Part D drug plan for you, your spouse, or a family member. Okay, well, that's my rant for today. I'm Kevin Canals with InsureMeKevin.com. Take care.